And good evening. Thank you so much for watching HealthLine here on PBS Fort Wayne. I'm your host, Mark Evans. We're going to talk about a topic that a lot of people don't talk about these days and didn't talk about it when it was very prevalent several years ago, but HIV. Is it still around? Well, the answer is yes. We're going to find out how it impacts so many people in the United States and some of the treatment options that are out there. In fact, we'll probably talk about all of them. I think you'll be pleasantly surprised. Tonight, we're talking to Dr. Michael Davis. He's an infectious disease physician. First time on the show, and thank you so much for being here.
Yeah, thanks for having me on. Appreciate it.
Absolutely. We were talking in the green room before the show, and I think we're going to have a really good show because of the topic and also the information that you're going to be bringing us. And we have a phone number on the screen. It's 866-969-2720, or you can drop the 866 if you'd like and use 260 and call our studios if you have a question about perhaps yourself, maybe a loved one or a friend. Please, by all means, ask. That's what we do on this show, is to help comfort you and also to let you understand about some of the things that we talk about and perhaps take some action on it if you need to. So go ahead and give us a call while we're talking at any time. We'll stop down. And of course, we won't stop down for commercial breaks because we are public television. So we've got a half hour to go with lots of information. So Dr. Davis, can you take us back to, it seems like an eternity, but it wasn't all that long ago, when HIV, which can transform itself into AIDS, but when HIV was discovered and when that pandemic, or in that particular case, it wasn't an epidemic, it was pandemic because it was worldwide. When did that occur?
Yeah, so, HIV has a very, I would say, emotional history, a very scary history. It originally started in Africa. We started noticing it in the United States back in the 1980s. And so back in the 1980s, we had this mystery disease where we were seeing young people, healthy young people, develop these really weird infections that we don't typically see. Weird infections like pneumocystis pneumonia is probably the biggest scare. Usually patients that we only really see get this are people that are in the transplant population where we're actively suppressing their immune system. And so we have this big caseload of all these people coming in with these weird infections kind of spreading across the United States. We don't have a clear cause of why these healthy people are getting sick. Eventually, we find out that there's a virus that's causing people's immune systems to go downhill. And it's a scary time because, seemingly healthy people are losing their immune system. And so if you can imagine the mass hysteria that's associated with COVID, this is probably amplified tenfold because it's a infection that's actively attacking your immune system. We didn't know how it was transmitted at the time, and people were getting sick and dying from HIV. Yeah,
it was a rough time, very rough time and scary time. I kind of akin it to the coronavirus epidemic, but it seems like the HIV thing, of course, it's, I don't know if you'd weigh one worse than the other, but they're out there.
Yeah.
So let's go ahead and talk about some of the things that are all about HIV. Who's most at risk these days?
Yeah, so HIV, generally it's transmitted through infected blood. Usually the populations we see transmission a little bit more frequently is people that are highly sexually active. We see it a little bit more frequently in the men who have sex with men population. We also see it transmitted through IV drug use. And so those are probably the key populations that we see it in, is usually sexual activity and usually IV drug use, just because those are those opportunities where you're actually going to get some bleeding potentially and some transmission.
Yeah, and let's go back to when it originated. Where do they think it did originate? I mean, it was in Africa, but was it something that just started upon its own? Kind of like some people think the coronavirus did, because of just, I don't know how to explain it because I'm not a doctor, but I mean, how do they even begin to figure out the origination? Was it through one individual, or was, as you mentioned earlier, a lot of people were coming up with the anti-immunity?
Yeah, so I would say similar to COVID, where we had all these people getting infected, and we started to trace it back. Well, once we discovered the HIV virus, we found out that it's very similar to a virus that we see in chimpanzees in West Africa. And so we do see this infectious disease where we have these crossover events where animals have infections and they do cross over into humans sometimes. And so it's very similar to a virus called the simian immunodeficiency virus.
Yes, that's coming back to me now.
And so that was the virus that we kind of likened it to. And so it started over in Africa is where we traced it to. And then eventually, just with how globalization of the world is happening, how it got to the United States.
Right. Okay. Now we talked about who's most at risk. Now let's go right into this, the HIV elimination efforts.
Yeah, so it's very interesting. So our biggest goal in HIV care now is really prevention, and that's probably our big focus. And so ways we can prevent it is, one, it's screening people for HIV, because most HIV transmissions occur in the United States through people that don't even know that they have it. And a lot of people that don't have it, they don't have typical symptoms until they get really sick. And so because of that, we have recommendations to get screened at as early as age 15, truthfully.
Oh, wow.
And so that's a USPSTF recommendation, so it's something that all doctors should be doing in their primary care clinics, is a one-time screening, at least for HIV. If you have higher risk factors, then yes, screen a little bit more frequently, but it's not a disease that we want to miss.
And I was doing some reading, and I think you even touched on it when we had a discussion before the show, that also among the who is at risk category, people over the age of 45.
So the people over the age of 45 not necessarily are at more risk necessarily, but it's actually probably the population that we see the most with HIV, mostly because they were infected way back when, and we're able to control it, actually.
Yeah.
Which really shows us how well we've been able to control it.
Yes, a lot of strides have actually been made. So let's take that 45-year-old. They could have been carrying around this virus and not even know it for how many years? I mean, we're talking 20, 25 years, possibly?
I would say the people that are in the over 45 age, probably less likely that they've been carrying it that long. Because if we're at that age range and we don't know it, usually they're going to be looking pretty sick, looking pretty frail.
I see.
Just kind of decomposing before your eyes from all the infections that are kind of building up in their system. What we're really seeing is this population over the age of 45. The reason why we have so many of those patients is because our treatments have worked so well. And so they're living longer, to the point that there's really not much age or life expectancy difference between a person living with HIV and someone not with having HIV.
That is astounding. That's amazing, because quite honestly, why it's so dark going back to those memories when HIV first started to pop up, I mean, it was pretty much a death sentence. I hate to say it, but how many friends have I lost? And how many friends have our viewers lost over AIDS throughout the years? And here lately, I would say probably, and you can disagree with me if you'd like, but probably in the last 20 years, we've seen some excellent strides.
Oh, yes, I completely agree. I mean, right now, we really don't get too concerned about people dying from HIV nowadays. It's dying from things like heart disease, things like cancers, which is the things we face as normal people without HIV.
Right.
It's those comorbidities, those other things.
Right.
Because nowadays, we control the virus, we can get it controlled within like a month or two.
Wow.
And at that point, really, it's just managing normal health.
Well, that's excellent, and that's good to hear. We have a call coming in. In fact, Jerry prefers to be offline, and Jerry, that's quite all right. We'll transcribe your question for you. Can you get HIV from a blood transfusion? Good question. That was coming up on my sheet here.
Yeah, so that's a really good question. I would say nowadays, no, because we screen for it. So all the blood that's collected through the blood bank, they screen for all these infections nowadays. So there's not really any risk of getting it through a blood transfusion.
And while we're on that subject, what about, the sex and all that? We've already talked about that, but just simple kissing, can you get HIV from that?
Actually, very, very unlikely they're going to get it through kissing.
Okay, well, that's good to know. All right, so thank you, Jerry, for that phone call. We're inviting more phone calls. The number is on your screen, so have at it. And I'll go ahead and ask some more questions to Dr. Michael Davis here, infectious disease physician, in case you didn't catch that at the beginning of the show. We mentioned screening earlier. How are they screening these days for HIV?
Yeah, so we've actually advanced the tests pretty far, to the point that we're actually detecting both proteins from the virus itself, but also antibodies you've developed for it. So generally, it's just a simple blood test. Some of them take as little as like 5-10 minutes to run, actually. And usually, if you've had the HIV or have an exposure, usually it takes about a month for it actually to detect the levels. And so just routine screening should be enough, but if you do have high-risk exposures, we usually do a little bit more specialized tests for those patients.
All right, and are there home screening tests for this?
So that's a good question. So right now they are coming out with some home screening tests. It's not heavily marketed at this point, but it is something that we are working towards because, people, if they're having sex, trying to get into a doctor's appointment just to get a test can be challenging sometimes. And so it is something that we are kind of working towards for the community.
Doctor, I personally, for me, I don't know if I want to find out on my own. Do you encounter that with some patients?
I completely agree because, a lot of people, when they have this high-risk exposure and they do have the concern, it can be a pretty emotional event.
Yeah.
And when they do find out that they have HIV, well, when they see us in clinic, it's such a tough visit.
Yeah.
Because people think that they're dirty. They're, they may die.
Yeah.
Because they still look at the stigmas that are associated with the past HIV that we used to see.
Yeah, yeah.
And so a lot of patients come in, their heads are down, they're tearful, they're afraid to look you in the eye because they don't know where their life's going to go now.
Right. Well, that's the only thing I think I'm afraid about home testing, and some people probably have more courage than I do.
Yeah.
But if I'm going to go in and be tested for something like that or screened, I certainly would want a professional, for instance, like a doctor, to help be there and soothe some of those concerns and tell me what is ahead. And we're going to work on this together, so you're not in this all alone.
Yes, and I would say generally too, so it's good to come in for that first diagnosis because we're going to work through it together. We're going to reassure you, we're going to get through this because really we are. As long as we're getting on medications, I don't really have too many issues.
Good.
And usually we have a pretty good support system in most of the infectious disease clinics across the country to help with this.
Excellent. They certainly have some experience on it, I'm sure. All right, so let's go ahead and talk about, the screening. We've talked about how and where. Basically, right now, until we get the home testing, it should be done in a doctor's office. Is that correct, or in a lab?
Yep. Generally, we'll send people to the lab for the screening tests.
Okay.
So.
All right. So let's go ahead and get into prevention, shall we? And we're going to take a phone call after you touch on the prevention aspect.
Yeah. So one of the big things for prevention. So we talked about screening, but we do have actually some really effective medications that can help prevent HIV transmission. And so generally what we say is, if you do struggle with IV drug use, if you've had sexually transmitted infections in the past, or just are a little bit more sexually active with multiple partners, you should try to come to see either a primary care doctor or an infectious disease doctor to get on medications. Generally what those medications look like is usually it's a daily pill to prevent HIV transmission, and they're 99% effective, especially through sexual transmission, and then 74% effective in preventing transmission through IV drug use.
Okay.
So very effective medications, and there's even now a shot that we have available that's just a shot every 2 months.
Wow. And are we still talking about prevention here? Or?
Still prevention, yes.
Okay. And what is that? What do those medications do? They suppress the virus, or they fight it in a way, or?
So that's a really good question. What these medications do is they build up in the tissues where there's most likely to have HIV transmission. And so by being built up there and existing there, the HIV virus doesn't have a chance to replicate or really infect cells with those medications on board.
Okay. We'll go ahead and take another phone call here. I've got lots more questions for you, Doctor. So let's see. Thomas has called in, prefers to be offline as well. He's asking, how soon can you discover that you have HIV? That's part one of the question. Part two is, he's heard that symptoms can show up years after contracting HIV, and we did discuss that earlier. But part one of that question is something we haven't talked about yet.
Yeah, so I appreciate that question, Thomas. It's a really good question. So I would say generally, when we first contract HIV, the symptoms that you typically will develop are kind of like a flu-like illness. And so most people don't really recognize it unless they're paying attention to their sexual practices or whether they engage in HIV or in like drug use. And so the tests that we have, I would say generally it takes about 4 weeks for those tests to become positive, confidently. And so usually, you know, if you do have symptoms or have high risk, I would recommend getting a test probably 4 weeks after that exposure. And as far as, you know, symptoms with HIV, so it's also a good question.
Oh, yeah.
Because early on, it's a flu-like illness, but most people undiagnosed, what's going to happen is their immune system's just going to continue to deteriorate. And it can take years and years and years for you to actually start to recognize that, hey, I'm losing weight. I developed a new cancer that was unexpected. I'm now getting these new infections that I wouldn't have expected to get. And it's not until some of those symptoms start to build up that people start thinking about it, and we test for HIV and find out that, well, the immune system actually is pretty low because the virus has been attacking it for so long.
But there are other diseases that can have the same symptoms or same track. Am I correct? I mean, just because you have the flu-like symptoms or you might have some other issues, I mean, you shouldn't panic at all, but you shouldn't assume that you have HIV right off the bat. I mean, there are some other factors and other diseases out there that can cause the same thing.
Yes, and that's absolutely correct. There's a ton of different infections that present very similarly.
Yeah.
And so unless you have a very high index of suspicion, a lot of times it goes undiagnosed.
Now, when you mentioned that you might have the flu-like symptoms, if it goes on for a long time, that's a red flag. I mean, you know, if it doesn't clear up, and what does flu normally take? About a week to get over?
And usually that's kind of what happens is, you know, if you first get infected, you might feel run down, you might get muscle aches, some fevers, and it'll last a week. But then after that, you'll feel normal. You won't even know that anything really happened.
But if you do have that, if it goes prolonged, that is definitely something you need to be checked out.
Oh, most definitely. And it's usually, you know, years before you start getting some of those weird infections or weird cancers that you wouldn't really expect.
Yeah, that's a sneaky thing about HIV.
It is.
Yeah. All right, so we talked about that. Also, give us a rundown. I noticed you had a blog that I was able to read, and it was very interesting, and I like how it gets to the point and it's clear cut. How many people, if you can answer, worldwide versus in America have HIV right now?
So in America, it's about 1.2 million people. That number is slowly increasing with time because people are living longer, because we have great control of HIV, and we don't expect people to die from HIV. So that number is going to keep increasing because people are living longer. The rate of, you know, people getting new diagnoses of HIV is actually going down a little bit in America. It was, gosh, I believe it was like 36,000 cases back in 2017, and it's down to like 34,000 in 2021. Still waiting on some new data. Prevalence of HIV is a lot lower than in places in Africa, unfortunately, because medications and screening practices aren't quite as great over there yet, just because of lack of resources.
Now, here's another thing. When you heard years ago HIV, well, it was almost like HIV equals AIDS. You know, and a lot of people got confused just because they had HIV, they would say they had AIDS. You know, so there was no definitive line drawn. So there are more people out there who have HIV than there are people who have AIDS. Yeah,
so the people with or what we call AIDS typically, we've actually tried to change the language a little bit about it and term it more advanced HIV.
Okay.
The reason being is because, you know, back in the 80s, 90s, we didn't have a lot of great success in getting people's immune systems recovered. Nowadays, you know, we see plenty of people that have what we'd classically say AIDS, but we get their immune systems back to normal just by controlling the virus very well. And so at that point, they're not really immunocompromised all that much. And so really, we just keep people in this advanced HIV term because we know we're going to be able to get them up and get their immune systems back up.
Yeah, well, unless people are keeping it very private, which a lot of them do, you just rarely hear of anybody dying of AIDS anymore. You know, there are once in a while I run across people who will admit that they have HIV, but they look very functional. They're doing well. They look good as long as they take their medication. That's the route they're going to take. They're doing well. You know,
yeah.
so as long as it's controlled. So, you know, you can just tell by this conversation how far we've come in the last, 25, 30 years. It's just amazing. We have another call coming in. Rebecca also would like to stay off the air, but we're going to transcribe her question. And she's asking, can you explain preventative HIV medications and what kinds of HIV medications are available?
Yeah, so that's a good question. There's currently, I would say, 3 medications that are approved for HIV prevention. The generic names, it's tenofovir and emtricitabine, which is the brand names would be Descovy and Truvada. Those are the 2 pills that we have available.
Truvada?
Truvada. Truvada is a little bit older of a medication.
I've heard of that before.
And it's a good drug. The newer medication is Descovy. It's just a slightly tweaked medication comparably. They're just as efficacious, they work just as well. Generally, what we say is, you've got to take the medication every single day. It takes, about, 7 to 21 days for that medication to build up in your system to be protective. And if you get on those medications, it's 99% chance that you're not going to get HIV on those. The newer medication that's on the market is something called Apretude, or generic is cabotegravir. And that's a one-time injection every 2 months. And actually is just as effective, if not more effective, than the pills.
Okay.
And so we do have some very good options available nowadays.
Well, and it's strange. We started out with HIV several years ago, and they've had several different medications. Why aren't some of those same medications? Well, it's obvious because they don't work anymore. But why don't those medications work anymore, and we have to keep finding new medications?
No, that's a good question. So way back when everything first started off, we would come out with a single drug, but then the virus would get resistant. And we kept running into this issue. This virus would continue to get resistant to our medications. And what we kind of learned is, this virus replicates very differently than other viruses, and that it causes a lot of mistakes in its replication patterns, allowing it to get resistant to medications. And so what we found is, instead of prescribing one medication that's going to attack its life cycle in one spot, we actually usually are using now 3 medications attacking the virus in different points of its life cycle. And we've designed these medications to be resistant to mutations causing resistance. And so a lot of our medications nowadays, we don't really get too worried about resistance, just because it takes a lot for the virus to actually figure out how to get past it.
Yeah, and I think it's just amazing how it just retransforms itself. I mean, the virus is a very tenacious. It just wants to keep on going, and it's going to change. So hopefully we can nip that in the bud. And then how does the future of those medications look? I'm sure there's a lot of research continuously being done.
Yeah, so the future of HIV medicine is very exciting. So right now we have very good medications. Unfortunately, right now it's a single tablet that you take every single day. Some people find that burdensome, but it's a really good medication. It does the job.
Yeah, a lot of people take medications every day.
Exactly, and to the point that it's really more just a chronic disease state than anything for us nowadays. As far as new medications that are coming out, so the goals for cure, they're still being worked on. A lot of science that's being done on those. But medications right now, we're working on one tablet once a week regimens that are getting studied right now. We're getting injections that are every 2 months to control the virus. We even have new medications that are in the pipeline that could just be an injection every 6 months, which is kind of as close to a cure right now as we ever have been.
Yeah,
so
we can't wait till we get to just once a year, and then after that beyond. We have about a minute left in the program, and I think something we need to talk about in this program before we wrap things up is reducing the stigma about HIV. Can you speak to that?
Yeah, and this is a big thing. I have this conversation with all my patients, and we all do as an HIV community, is, having the infection, it really is just a chronic disease nowadays. It's a medication, or it's a virus that we can control very well. And just because you have the virus, it doesn't make you dirty. It's just another chronic infection that people get. And so one thing we always try to emphasize to people is, once we get you undetectable in your blood, which takes 1 to 2 months, there's no risk you're going to transmit it at that point. And so we encourage people and say that, you equals you. Undetectable equals untransmissible.
Wow.
And so you can live a normal life. You're going to have the same life expectancy. We're more concerned about your cardiovascular health, truthfully, than the virus causing you to develop other
Right.
complications.
So you think maybe you have it. What should you do? What's the first thing you need to do?
So I think the first thing you need to do is contact your doctor and say, hey, I'm concerned that maybe I could have contracted HIV. They can order a blood test. They can also connect you to the appropriate resources to get medications to help prevent you getting the virus and also connect you with care.
All right. Dr. Michael Davis, Infectious Diseases Physician, thank you so much. This is a very good conversation. We needed to have it, so I really appreciate you being on the show tonight.
Yeah, thank you so much for having me tonight.
And we'll have you back again soon.
Wonderful.
Thank you. Thank you for all the work you do as well.
Yes, thanks.
And thank you for watching PBS Tonight, HealthLine. We'll be back next Tuesday. Until then, good night and good health.
The preceding program on PBS Fort Wayne was made possible in part by...
It's a new day at Parkview, another day to rise up and make life better for those around us. Whether that means pushing the boundaries of what's been possible, taking big strides, or sitting with a patient long after a shift has ended. At Parkview, we don't just do what's expected. We do what's best for you and your family. And we're determined to do it even better tomorrow. Every person, every day. That's the kind of healthcare we believe in. Parkview Health. We believe in better.